continuing on here with our simulation with Birgit with her swollen hand. And now we're moving to the point where we're going to teach Birgit how to manage her own edema. Okay? So one of the most important tools I have in working with patients is to actually use patient education materials, and we'll put it up here so that you can see it. You actually have this in your materials. And now we'll go back here and take a look, and I'll show her that, Birgit, you have 3 pump points here that'll help pump this edema out. You have a lot of little vessels in here filled with lymph fluid, and their pumps are getting a bit used. They're backing up. They're not doing what they need to do. We need to give them a little bit of help. One thing that's important to remember is the vessels in your arm are a little bit like overcooked spaghetti. So we want to treat them quite gently. We don't want to squish the spaghetti. We just want to get things to move along. So we're going to take a look here. Your first pump point is actually up here. It's in the hollow of your neck. Okay, and so you're going to take your finger, and I'll demonstrate, and then I'll have Birgit do it. She's going to take her index finger, she's going to lay it in the hollow of her neck, and she's going to gently pull to and relax. Pull to and relax 5 times. 1, 2, 3, 4, 5. Wonderful. We've done our first pump point, and it's always important to remember that we're going to start at the top because we want to open everything up so that things can begin to flow. Her second pump point is here under her axe flip. Now you want to take your hand and slide underneath there and pull up. Slide underneath and pull up. Slide underneath and pull up. And she does that really well. If I were doing this with a patient, I often take a tissue and put a tissue on my hand and then pull up and down. Okay? Just because, well, it doesn't always smell so good underneath, right? Okay, good. So we've done our second pump point, and now we want to do our third pump point. And our third pump point is here, kind of in this area of the elbow. So we're going to gently pull towards her and relax. Pull towards and relax. Gently pull towards and relax. Towards and relax. And as I instruct Birgit, she can just take the ball of her hand and gently pull to and relax. And I might want to remind her, patients often want to be quite firm, but you don't want to squash the spaghetti pump. You just want it to roll. You want it to do a little work here. You want to kick it into it. Okay? So once she's got her pump points open, then we're going to start here and do some effleurage and just walk this fluid up the arm. Okay, and I can use both hands, but she can use one hand. Very good. And you want to do that about 5 times. Wonderful. Good. Now we're going to look at the other side because we have swelling on both sides. And one thing that's very important to remember is we have a watershed here. So as we work the fluid down the fingers, it actually drains over the back of the hand. So we want to work the fingers down, and then we have to walk it in between each finger and over the back of the hand. Same thing for the water here or the fluid here. This area is going over the back of the hand. Really only the middle goes down through the hand. So Birgit, you want to try that? Good. Now you want to walk it over the edges. Exactly. Walk it over there, slide it to the top of the hand, and gently escort it right on out, up your arm. There we go. Good. Very good. 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 Now the fluid that's in your forearm, exactly, you can gently send it right on up your arm there. There you go. After she gets going, she's also going to want to go back and reopen those pump points. As they start to get more fluid in, they need a little help. So she's going to remind them, this is, you're supposed to be doing your job here. Keep working. 4, 5, and then again onto the axe flip. 2, 3, 4, 5. And then down here, 1, 2, 3, 4, 5, and then your effleuраges. You can see it didn't take me very long to teach Birgit to do this. She can do this at home. She can take responsibility for it. Of course, when we're in therapy, we can work on a little bit of lymph drainage, but lymph drainage is only part of it, and it's really important to give the patient the responsibility to work on this at home.